I'm a serious. The same got to move, I'm a sissy. You call me, could be a bar, me bar. I'm a dance, I can't have a contact. Cause we have to move in show, baby. Take me out to my den, I'm a deep. About you met so many chilipi. This I think I crave you, been bunny me. Friday, I could be in my club. When I'm by your bakuya, I'm a talking. One corner, one lana. So, what's your say, and I am. I run to my bro, me down, come on. The music, I'm a memory. I'm a memory. Tell me about what I'm on you. Tell me about what I'm on you. I get to get in the shower. I get to get in the shower. Tell me about what I'm on you. Tell me about what I'm on you. I get to get in the shower.
Praise the Lord, hallelujah in the highest. What's it in your me? All by your mercy and your grace, I am grateful. You've turned my life around. Now I'm a shining star.
Yeah, I said about this kind of when I'm body. Me this car, me go to but I'm a planet. I don't want to go do my routine, I have me. Di ma teme kame kuti pona wabe kame. Woka masem de via minti. Mene woka na se minti. I'm focused. Ebe same ame ombas. Enche on a fe. Abe bu sembe na mante. They say my song be a real kwa. And so minti be a just having kwa. I know go run from me. Today them say they be. Nani na me da say. Mama tavon gaso tiase. Tell me pano kamani. Tell me pano kamani. Kakiti give me the shabby. Kakiti give me the shabby. Tell me pano kamani. Tell me pano kamani. Kakiti give me the shabby. Kakiti give me the shabby.
Praise the Lord, hallelujah in the highest. What's it in your name? All by your mercy and your grace, I am grateful. You turned my life around. Now I'm a shining star.
I'm a serious. Me say me got to move, I'm a sissy. You call me, could be a bar, me bar. I'm a dance, I can't have a contact. Cause we have to move in show, baby. Take me out to my den, I'm a deep. About you met so many chilipi. This I think I crave you, been bunny me. Friday, I could be in my club. When I'm by your bakuya, I'm a talking. One corner, one lana. So, what's your say, and I am. I run to my bro, me down, come on. The music, I'm a memory. I'm a memory. Tell me about what I'm on you. Tell me about what I'm on you. I get to get in the shabby. I get to get in the shabby. Tell me about what I'm on you. Tell me about what I'm on you. I get to get in the shabby.
Praise the Lord, hallelujah in the highest. What's it in your me? All by your mercy and your grace, I am grateful. Now I'm a shining star.
Yeah, I said about this kind of when I'm body. Me this car, me go to but I'm a planet. 89.7 Di ma teme kame kuti pona wabe kame. Woka masem de via minti. Mene woka na se minti. Focus.
All right, good afternoon and sincere apologies for that technical hitch. More to do with my getting in the studio, but I'm here now. You're welcome to Ultimate Health on Joy 99.7 FM. Today we decided to pull back physiotherapist Sami Otu. look at some common physiotherapy presentations. Sammy, good afternoon. Just repeat that. I can't hear you. Yep. Yep. Okay. Good to have you again.
Yes, good to be here.
We started this series. I've got a lot of listeners asking for some specific issues, and so we decided to do a kind of a throwback and look at common physiotherapy presentations.
Sure.
Which means working publicly and professionally, you will have a profile of the common things Ghanaians have problems with when it comes to physiotherapy.
Sure.
We also want to recall that we have a lot of impatient listeners who were keen on your vouchers. Remember the first time we had you was your birthday.
It was my birthday.
He gave us 7 vouchers. I asked for an even number, so we got 8 to give out.
Sure. Sure.
3 from today's program, and then there are a couple of you who sent some messages during the earlier programs. Okay? So we'll do that. So
Great.
Sammy, just kick us off. We define physiotherapy.
Yes.
Just give us that again, and then we'll go into the top 3 or 5.
Great. All right. So I want to say good afternoon.
Joy 99.7
So
FM.
physiotherapy basically is the branch of healthcare that deals with wanting to maximize movement and function.
Okay.
So anything that will prevent you from doing these two things is what we are interested in.
Okay. Right. Now, Sammy, movement and function.
Yes.
Indeed, we were created to move.
Exactly.
And movement is life.
Yes.
Right. Now, I've seen some I think it's a video of yours where you're saying that, look, if we don't move often enough,
yes,
something happens to us.
That's correct.
Essentially, just explain that to my listeners.
So, so the body, has a lot of structures in there, but then we have bones in there, we have muscles and stuff like that. Now, the bones would give us our shape, and enable us to be erect.
Form,
our form, exactly.
And
now,
posture.
the bones meet at places we call joints. So there are a lot of joints in the body. All right. Now, when you take a typical joint, there are different kinds of joints in the body, but majority of the joints are what we call synovial joints. Sorry. Now, synovial joints, like the joints we have in the knee joints, the hip joints, most joints have what we call the synovial fluid in them. So the two bones making up the joint don't touch each other. There's a gap in there, and in that gap is what we call the synovial fluid.
Right.
And this is what really lubricates the joint and makes sure that movement is fluid and smooth.
Okay.
You don't feel any hitches. It also nourishes the joint. Now, unfortunately, you cannot inject synovial fluid into the body.
Okay.
The body produces its own synovial fluid.
Right.
All right. Now, what will stimulate the production of synovial fluid or more synovial fluid is movement.
Okay.
So what you are doing to yourself when you stop moving or you minimize your movement is that you are causing the body to reduce the amount of synovial fluid that is produced.
Okay.
And that eventually will lead to stiffness and pain and, you not wanting to move.
Over time.
Over time, yes.
Right. Inadequate movement. Physical
movement.
activity.
That's correct.
Will result in pain and what?
So stiffness first, and then pain, and that would, of course, reduce your quality of life, and
Okay.
now you don't feel like moving again,
Okay.
and that will lead to a more reduced synovial fluid production, more stiffness, more pain, and the cycle continues.
Okay. So that is, should I say, a deadly cycle.
It is.
Even
yes.
though we are often also referred to a certain balance of activity and rest.
And rest, yes.
Right? We do need rest.
Yes, we do.
But inactivity is what you're talking about.
That's correct.
Okay. So what would you define as significant inactivity? I mean, I go to work, let's say, I'm a typist. These days, they don't use that. But
Yeah.
I sit for ages.
Yes.
Right?
Yes.
I'm not likely to get up and move most of my working day.
Sure.
Is that significant enough to set in place the cycle you're talking about?
Yeah, so when it becomes repetitive, so if it's just a one-off thing, I went to work on a Monday and I had a lot of stuff to do, so I had to sit down for long hours, and it was just on a Monday, it may not cost much.
Okay.
The problem comes when it becomes a routine. So where you get to the office, let's say by 8 o'clock you start working, you're seated behind your desk till lunchtime. And then you get up, go for lunch, come back, sit down again till let's say 5 p.m. And that becomes a routine. So
Right.
the problem here is that
it's no longer an incident, it's a pattern.
Exactly, it becomes a pattern.
Right.
Yes. Now, anytime we sit down for that long, and when I say long, the literature will say like 2 hours plus. and it becomes a routine. Because here on Earth, the force of gravity is acting on us, preventing us from floating like in outer space. Unfortunately, this force of gravity has a tendency to put pressure on the intervertebral disc, which is found in between the bones at the back, and too much of that will eventually cause the disc to degenerate, and that will lead to a condition they call, lumbar spondylosis, and that comes with, all the other stuff we spoke about last time. Yes.
Great stuff. Movement is health, is life.
It's life,
right? Yes. If you don't move frequently, adequately, then you're compromising life. There'll be stiffness, there'll be pain overall, there'll be reduced production of synovial fluid, and that's not a good thing, says our physiotherapist Samuel Otu of the Physio Specialist Center. They've got some vouchers for us. I will definitely give some of them out. In fact, let me see. This one was a couple of weeks ago. It doesn't have a name, but I want to give this one. Hello, Nortey. I've been having severe back pain from 2016. I've been to Focus, Ridge, Tema General, and they all say there's nothing wrong at all. At Focus, I was asked to do the MRI, which I did, but till today, no help. Where can I see this physiotherapist? I have your number. It ends in 597966. A voucher for you, right? Male or female, right? I'll get in touch with you after this program. That's our first one there. Okay. I'll do another one. If you send in a message today, you're likely to win one, and maybe if you call as well, right? Dede in Maryland, you are not here. I'll lay hands technically, all right? But Ultimate Health on Joy 99.7 FM. Sammy, I begged you to send me your top 5. But before that, even this morning, I got a message from Seoul in Korea. Professor Albert Akpalu is out there.
Yes, the big man himself.
He says, I don't know whether he knew I was bringing you back. Bring the physiotherapists back and emphasize their importance and role in the management of neurological disorders. Speak to us on that for a bit.
Well, so when we talk about neurological disorders, basically we are seeing problems with the central nervous system, when anything goes wrong with that. So let me break that down and give specific examples like stroke.
Stroke.
Yes.
Okay.
Basically, so stroke can be either ischemic, or let's not bore listeners with that.
Stroke.
So basically, the patient.
Actually, Prof. Albert Akpalu is asking for a segment on who a neurologist is. He forgets that I have focused on the neurologist. I had almost all of them in this studio. But Albert, all right, I've heard you.
Yeah. So basically what is happening is that the brain is unable to function as it used to. So every function that we do, I can say, is controlled in the brain. So the brain is a control center, exactly. Now, when certain things go wrong, and when I say certain things go wrong, like there could be a brief lack of blood to a particular part of the brain, and let's not forget that blood actually carries a very important commodity called oxygen.
Right.
So for a period, your brain, a part of your brain, is starved of oxygen, and that will lead to what we call a CVA, a cerebrovascular accident, which is stroke.
Right.
Yes. Now, so that is what has happened in your brain. Now, the consequence of that is that you have weakness on most often one half of your body. Right. I mean, it depends on which part of the brain that's affected. Exactly. Yes. Exactly. Right. Yeah. So of course, when this happens, yes, neurologists will come in. Physician specialists, they need to stabilize you, blood pressure, sugar levels, and all of that. Now, afterwards, we as physios need to come in and make sure that you're coming back to your normal function abilities.
We call it new normal.
Exactly. We call it a neuro rehabilitation.
Rehabilitation.
Yes, neuro rehabilitation. Exactly. Okay. So, of course, what happened up there in the brain caused a few things to change.
Right.
The good news is that the brain has a tendency or an ability called neuroplasticity. Right. It has an ability to reorganize itself. So there are specific things that we take patients through to make sure or to help the body relearn some of the things that is forgotten because of the accident that took place up there.
Okay, great stuff. 28 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey by nature, a bit late, but that is not by my nature. But we're talking about common physiotherapy presentations, the common complaints that Ghanaians take to the physiotherapist. We've got a former president of the Ghana Physiotherapy Association, Samuel Otu of the Physio Specialist Center in Jolu.
Abelenkpe.
Sorry. Abelenkpe, right. And he first appeared this year on his birthday, and he offered us some vouchers for assessment and treatment. I'll let him explain what that means so that you know what you get. If you don't get it, come tell me and I will physically terrorize him, right? But WhatsApp is 055 11 11 997. Shortly, I'll activate the phone lines. We've got some 7 vouchers to give away for those assessments and treatments at the Physio Specialist Center, right? It doesn't necessarily mean that Sammy will be the one dealing with you, but that's what we're talking about. This one says, is the physiotherapist responsible for working on the spinal cord? My back, waist, and neck hurts because of bad roads. Bad roads, okay? Any advice for now until a visit to the specialist? So he surmises that this is because of bad roads, right? He wants to know if you work on the spinal cord, perhaps directly or indirectly, and he talks about his back, waist, and neck.
Okay, so let me start by saying that so when you come to the healthcare system, I mean it's a team. We call it a multidisciplinary team, and so there are different people in the healthcare system that work on what he calls it the spinal cord. But I'm sure he has complaints or pains on the back or something. We'll have to find out whether it is really the spinal cord that is at fault. So yes, physio will do stuff, but we don't work alone. We work as a team with the
Would you
doctors.
love to give this person a voucher?
So let me. So what he's saying specifically is.
It smells like I'm saying that. It may be a lady, but there's no name yet. I'm scrolling up. Yeah, but go ahead.
Okay. Yeah. So he talked about bad roads.
Bad roads.
So driving on bad road, which is common.
So
for
the
most people.
stressor is active.
Yes. And what is happening can be likened to a lot of vibration. So people, I work with people who work in their minds, and they complain of back issue because of the nature of their jobs. A lot of vibration.
Right.
Now, the least you can do, before you even come for anything, is to make sure that you are toughening your body.
Right.
I keep on, and this is so important. I talked about the
you
body.
Want to enhance the resilience of his body.
Exactly.
To bad roads.
Exactly. So the body, like I said, has bones. The bones cannot move by themselves. They're just there. They are like sticks. What actually brings about movement and stability are the muscles. Now, when the muscles are tough enough, it doesn't matter what happens. Of course, we pray we won't have bad days, but they will absorb. Exactly. Right. So there are specific exercises that we teach to really toughen you. As we wait for the MCs and other people to fix the road, right. You can also toughen your body up by doing specific exercises to really help mitigate some of these stuff. Yes.
All right. Clarified here, he's a male called Nana Kwesi. Nana Kwesi, wherever you are, I'm giving you a voucher to toughen your muscles. Maybe if it doesn't help in your absorption of the road shocks, it can toughen your hand to give a DC or an MC a knock, right? To get that road done. So Nana Kwesi, his number is here. Ziggy, please note that down so that I don't forget him. That's the second one I've given out. Okay. So we've talked about neurological disorders and where you come in as a physiotherapist. Okay, right. For Nana Kwesi as well, did you address whether you directly work on the spinal cord?
Yeah, so like I said, there are structures at the back, so a client will come in and say, oh, it is this thing that is hurting, I mentioned some organ or something, but obviously there needs to be an assessment to really find out what really the problem is. Is the pain there as a result of a certain crack, a certain bony issue? Is it there are so many structures at the back, so it may not really be, the spinal cord is very protected, I should say. It's not, you can't, just feel your spinal cord. Right. It is very protected at your back.
So, zone.
Yeah, so the fact that you feel some pains at your back may not necessarily mean that it is your spinal. It's a very sensitive structure, and God in His wisdom has really protected, well.
Please investigate Nana Kwesi for me, right? To make sure we know what's up with his back, what he's been up to.
Yes.
Right, this one says, hello, Nortey, I drive a lot. What does your resource person advise? Patrick in Kaswa. Driving.
So driving can be likened to sitting. It's actually sitting. So if you are saying that don't sit for long in your office, then the same way to driving is, don't do that for long. I know that we have to endure the long traffic and stuff, but the ideal situation or the standard is that maximum after every 2 hours, you get up and you stretch. You get up and you change your position, you stretch. All right. So if you're in the office, my advice would have been that get up from your seat, stretch a little, move your body from the side to the side, from the back to the front.
Okay.
The same way too, you can actually park. To do this for just about 10 seconds and sit on again. It helps your back to refresh.
Okay.
Anytime I say this, people go like, oh, there's no time, the traffic and all of that. But the truth is that it has a long-term effect, especially if it's a routine. You always do this and you get up from the car with a lot of pains on your back.
Stop, do the stretches. Right?
Yes.
You say 2 hours is
so maximum after every 2 hours, exactly. You can do that.
Anything beyond 2 hours, you consider that to be
a problem.
Extreme,
exactly.
2 hours at a stretch,
yes.
driving.
Yes, driving.
Okay, so what about the daily commutes? Because some people spend about an hour and a half, 2 in traffic, they get to work and they do the same thing going back.
Yes.
So they qualify for your
yeah,
consent.
they do. Yes. So we're just saying that instead of doing it continuously, break. So if you were in the office, I'm saying that get up from your seat. The same way to if you are driving, it's also certain. I mean, when patients come to us and tell us what the problem is, we need to break that down into what really is happening in there.
Okay.
Sitting actually can put pressure on the intervertebral discs.
Okay.
Because you're sitting, especially when your back is not supported. So a lot of people also drive.
So we're interested in your sitting, your posture, the kind of support you have.
Yes.
Right? And
yes.
then, of course, the duration and intensity.
Exactly.
Right.
Sure.
Okay. Great stuff. Ultimate Health on Joy 99.7 FM. With me, Nortey by Nature. I'm with Patrick Sammy Otu of the Physio Specialist Center in Abelinkpe, right? Kwame Ndansoman, right? He talked about his wife and then I was referred and he says, my wife's neck and throat pain is becoming severe. Any solution in line? First of all, Kwame, why are you waiting for your wife's neck and throat to become severe and waiting for Nortey by Nature before you do something about it? I don't like the sound of that. Wifey, please call us directly and we will deal with Kwame for you. But what would you say about this? I think I'll scroll up.
Yeah. So once there is pain in the neck, it would be good to do an assessment to find out what really is. And when I say assessment,
Ziggy and I will be oral because some of these complaints. Look, he started from September 28th. My wife has been experiencing pain at her back, neck, and the front throat. What could be the cause? Please, I need one of the vouchers. Kwame, right? This man is Ziggy. Please, we will check Kwame and his wife and see who has the pain. But yes, continue.
Yeah, so it's always good to have a thorough assessment to really find out what the problem is. I mean, once he's talking about throat too, we will need to know if there's a need, for example, to refer to the ENT specialist, but we will do our assessment, which includes, of course, subjective and objective assessments and our physical tests that we do to really find out whether it is indicated for physiotherapy. And if there is, there's a lot we can do to help.
Kwame has been chasing us since September. Voucher back. Listen to this one. Dorothy in Achimota. Okay, Dorothy, I can't recall your name, but you have appeared. Kindly give me one of the vouchers so I can see the therapist. I have severe pains at my back. I visited Focus and I was diagnosed with cervical spondylosis. I was treated and the pain disappeared. This was 5 years ago, but the pain has reappeared and I sometimes hear this snap sound at my back. Dorothy in Achimota.
Okay, so you see, the issue here is that, when people say, for example, that I was treated and the pain went away.
Yeah.
I mean, there's no way that you would visit or you should visit a physiotherapist and you would go without him or her teaching you exercises to go away with.
Right.
Because whatever caused the cervical spondylosis is still there. Right. Most often that is linked to your postures. And you are still working, you are still doing stuff. The body can tolerate things for a while. So there are specific exercises that you need to do even when the pain is zero. Yes.
You need to continue.
You need to continue.
Right.
Because the stresses are still there. You are still working. You are still and
so
chances are that.
Hang on, Sammy. Is this a patient in default?
I mean, we may have to investigate it, but I'm just saying it's a common thing, a common narrative for people to say, I went for treatment, it got better, and she's saying 5 years ago, it got better. And the body can really tolerate a lot of things, so there's a whole, maybe 5 or even a whole year you may feel nothing.
If you had to toss a coin between Sammy, who's been watching his wife's throat, and Dorothy in Achimota. Who would you give a voucher to? If you give them both, I'll be there, because as for Kwame, I need to see his wife, because I see he texts like this. I am suspecting this Kwame. But who would you want to give a voucher to?
Wow, that's a tough one.
It's a tough one. It's a tough program. Yes, shoot.
Well, I mean, I would love to. Kwame's.
Should we baptize both?
I guess so. Let's do both.
All right. So Kwame in Dansoman,
yes.
Right, and Dorothy in Achimota.
Yeah.
Right, we'll list you, but hey, please, we will vet you, Papa.
Yeah.
Dorothy, yours sounds like a typical pattern.
Yeah.
So Sammy and the specialist physio center would want to lay hands and see, and also give you continuous, should I say, routines to continue doing, and probably some system of reviews. Am I right?
Yeah. So I think I mentioned this last time. So for example, when a patient comes to us, there are three things we are doing. The first one is to do a postural assessment.
Right.
We need to find out how we got here.
Okay.
What has caused this? So a postural re-education. Okay. And there we will actually teach you how to do certain basic things, like sitting down, like even sleeping at night. Mattress, pillow stuff, and all of that.
Okay.
Even standing, how the best way to do it, because that is the source. If we don't correct that, you're going to go back into it. So that's the first thing we are doing. The second thing is to actually correct what has gone wrong. So that's where we do all the spinal manipulations and all of those stuff. Then the final thing are the specific exercises we are teaching you to do at home. Okay. Because whatever we achieve in a clinic, it needs to be maintained.
Okay.
Yes. So don't say that after the session I got better, I feel better, and that's the end of it. You need to maintain
bad things you were doing before.
Exactly. Go and do the exercises to make sure you don't go back to
good things. Don't go back to the bad manners.
Yes.
As my Kenyan and Ugandan friends would say. All right. 055 11 11 997. Joy FM 0302216541. Those are the healthy buttons to push as we consider, define, refine, and manage common physiotherapy presentations. Okay, with the Physio Specialist Center, Sami Otu. This one says, what should my mother-in-law, who is still having pain on her one side due to being knocked down by a car about 7 years ago, do, please? Right? Sparse details. We'll need one of the vouchers. Oh, babe, 7 years ago. This is Joshua. All of these are new converts to Ultimate Health. 7 years post RTA. Sammy, say something.
So I'm curious to know what happened after the incident. I mean, was there any check? Did they do any, for example, X-rays or any scan to know what went wrong?
One-sided.
Exactly.
He's not saying weakness. He's not saying hemiplegia.
No.
Right?
No,
but suddenly
this traumatic.
He does end with the legendary statement voucher. What would you say?
Yeah. So it will be good to have an assessment to really know what is causing this pain. I mean, pain is the body actually telling you something is wrong. So we need to get to the bottom of it and know why is the pain.
Should this assessment be free? He needs an assessment. Yes. His mother-in-law needs an assessment. We understand that. Post-road traffic accident, we understand that. Okay, that seems to be the indexed reference or antecedent, right? Now he says for 7 years she's had this problem, and he needs a voucher all of a sudden. That's my problem. Yeah. Would you take your mother-in-law for assessment without a voucher? That's what I'm considering, right? Ultimate Health, Joy 99.7 FM, 42 minutes past 2. We're in business because we've got vouchers. You guys are bad. But hey,
Joy 99.7.
We're here for you. All right. So Joshua, call me. My phone lines are active. 030-221-6541. Let me know. Would you take your mother-in-law? It sounds like a drive time scenario for assessment if it was not free 7 years down the line. All right. Now, Sammy, you tell me an assessment includes a postural assessment, spinal assessment, muscular assessment, including core stability, muscle tests, etc. And then treatments will be based on the findings. Just quick explanation of what the voucher.
Yes. So once you come in, I mean, like we do for all our clients, we need to, we are comparing your body to how it's supposed to be.
Right.
Your posture. We are checking your postures, how you normally would do your usual basic postures.
So your deviation from the norm.
Exactly, that is it. Deviation from the norm. Yes, we are checking that. We are checking your muscles, and the muscles is not just the global big muscle that we see. We're also looking at your core stability, because that is one of the group of muscles that is usually ignored.
Sammy, I know I came late and I'm speeding. We've covered a lot of ground, but core stability. I know. Say what's that? Core stability.
Core stability, yes.
Right.
So these are a group of muscles that are very important. They are the muscles within. They are closest to the bones, the spine in there.
Okay.
And that is when movement is initiated. They are tiny.
Okay.
Example is the multifidus. The another example is the transversus abdominis. There are quite a number of them. Now, when they are not working optimally, they can just give you issues, musculoskeletal issues.
Right.
And for most people, that is the problem.
Okay.
Everything is fine. They've not had a fall. They've not had any accident. Everything is okay. It's just that their core stability muscles are not strong.
And that can be determined by an assessment.
Yes, there are tests that we will take you through to check the strength of that. And if it is, there's a problem with any of them, we can teach you specifically what to do.
Okay.
But these are all exercises which can easily be done at home. You don't need any gadgets or any tool. You just need a mat or something, or a bed at home to do.
All right.
Yes.
Dr. Nashele Ashite of Nova Wellness. I greet you. Oh, I greet you. I can actually picture you sitting next to Sammy, pound for pound, boot for boot, because we're in a certain territory, a certain domain. We'll yank you back one of these days. As soon as I, have a resource person, frequently people think there's something up, especially if she's of the other, yes. But yes, okay. So, mother-in-law, please call us and define and validate your mother-in-law's one-sided pain 7 years post road traffic accident. Hello, greetings, Mr. Nortey Dua, all in bold, Charlie, and Ultimate Health Team. Please, what is sciatica, and what can be done to prevent it from occurring? Pass or low? Even the fact that you didn't mention voucher makes me want to slap you with a voucher. But Pastor, thanks for your question. Quick.
Yeah, so sciatica basically means pressure on the sciatic nerve. Okay. The sciatic nerve is the biggest nerve that controls the legs. So it starts from somewhere, the lower back, and it goes all the way through your buttocks, down your hip, your hamstrings, the back of your thigh, and then the legs. Now, when anything puts pressure, impinges on the sciatic nerve, we call it sciatica. So what the patient will be feeling will be pain, usually at the lower back, and pins and needles or numbness or tingling sensations along the path of the sciatic nerve. Now, what will put pressure on the sciatic nerve? Usually you will get it happening at the root where it connects from the spinal cord. All the nerves come from the spinal cord. Right. And an intervertebral disc or a bony spur can put pressure on this. However, there is another cause of sciatica which we call the piriformis syndrome, where a certain muscle called the piriformis muscle, which is connecting from your hip to your sacrum, the sciatic nerve for most people passes through this nerve, so this muscle, sorry. So when there's strain on this piriformis muscle, it puts pressure on the nerve, and that will give us the same symptoms. So usually what we will do when we are treating sciatica is to first make sure we know whether it is coming from the lower back, which is the root of the nerve, or it's coming from the the piriformis muscle. And there are specific exercises that we do test to do to really differentiate. And once we know where it's coming from, we can manage it.
Okay, where you're hearing all this is from Joy 99.7 FM. I don't know the nerve, but it's 99.7 FM. I am Nortey by nature. My guest, Sammy Otu of the Physio Specialist Center in Abelinkwe. I've got something up here. Hi, Ni Nortey. I always refuse the ni, but I'm Ajay Dua, or Ajay Dua from Teshin. All right, so probably related. Please, you brought an erection doctor, not election, not pink sheet. The other pink sheet that the men are interested in. An erection doctor some time ago. And please, I would want to get in touch with him. It was a hair, but when you go there are many, should I say, professionals that will see to you. That was Dr. Na Ashele, also Teshi Ashite, right, of the Nova Wellness Center. So ni Ajay Dua, I will send you the details so that you can conduct your elections. Sammy behave. Men yes sir. It's Sunday la. It is Sunday. Ultimate Health on Joy 99.7 FM. So I've dealt with Nortey Dua. Yesterday I listened to one of these Ghana programs, Obonu, but there's this pretty woman and she's not a young girl. It's something Peregrino Brimer. Wow. The education in Ghana.
Wow.
Stop that. Don't go there. Right. Okay. Great stuff. I still have a couple to give. So you get an assessment and you get treatment. The treatments, what is
Yeah, so based on the assessment, we will be able to know what needs to be corrected. It could be somebody who has no
so the
symptom
voucher
of pain.
gives you assessment plus treatment.
Exactly. Yes. So, for example,
when is your next birthday?
That'll be next year.
Oh.
Yes. So once there's a problem or there's an issue, that would determine the kind of management that we would use and or we'll give to you. Usually. For the management, we are, like I said, if it's something related with the back, we may do a spinal manipulation or mobilization.
Which one is the electrotherapy?
So electrotherapy basically is using an electrical gadget which produces very specific refined electro current or electrical current.
I used to have that some time back at 37.
Yes, so it's able to
spasms.
Exactly, yes. It's able to stimulate the body's natural pain relieving mechanisms. Yes.
Great stuff. If I could get one of the vouchers, Senyo Peklu, thanks, Agbena. This is a straight pink sheet, right? As the gazetting officer, Charlie. Hey, why? Oh, goodness me. I love this program. This is Mrs. Teresa. What does it say, Mrs. Teresa? Dear Doc, no. All right, I have lower back pain and therefore mobility is difficult. My MRI indicates that I have nerve compression L3 to 4, L5, and SI, I think. I have taken medications for almost 5 months. Celebrex, Doretta, Lyrica. I have been stretching, exercising, and even went to see a physical therapist for 12 sessions, but I am still in pain. I have already taken epidural, but it did not work. Can the physical therapist help with lower back pain? Mind you, she has already seen a physical therapist.
Yes.
She's gone through medication. She's done imaging. Her MRI indicates where problems have been identified and located. Doc.
Yeah.
She's Mrs.
Teresa. I'll certainly love to meet her. To continue from wherever my other colleague left off. There may be a few things.
On basis of a referral or a voucher?
Well, that depends on you, but I'll simply love to meet Madam Teresa to really.
Okay. I'll give Mrs. Teresa. I love the way you wrote Mrs. Teresa.
Yeah.
Right? We will do that, okay? And then the last couple, I have a couple in the last messages from 2 weeks back.
Sure.
Okay? So
sure.
we've done some justice to
Yes.
right. 8 minutes to go, right? You've done the treatment and assessment, but you mentioned low back pain has come up as a common presentation. Is there anything you quickly want to say on that in about 2 minutes?
So low back pain is very common.
I have somebody who'd like saying the small of my back.
The small of my back.
The small of my back. Is it just
so
above your buttocks?
So low back pain
Right.
is pain you feel from any area between your last rib and then the lower gluteal fold.
Okay.
So from your last rib, which you can actually palpate and feel somewhere there, and then your buttocks, the lower part of your buttocks. So anywhere within this area, we categorize as low back pain.
Low back pain.
Yes.
Okay.
Now the back bones, there are 33 of them.
Right.
Not the last 5. So we have the first 7, the cervical, the next 12, the thoracic.
Okay.
The next 5 are called the lumbar vertebra. Now, these are very prone or most prone to injury because one, they bear a lot of load. You know, the spine actually carries your load. I mean, your weight. So all the viscerals, the stomach and all the visceral organs in there, plus the fat tissues that are usually accumulate around that area, put a lot of pressure on the lumbar spine. So it makes it more prone to injury. The second thing is that a lot of movement takes place at the lumbar, spine, the lumbar vertebra. So it also makes it prone to injury. Now, because of that, it is important and crucial that we really are intentional about what we do for our backs. All the things. I mean, low back pain is the common. As you say, if I see 20 patients in a day, I can comfortably say that about 15 of them could be low back pain.
Low back pain.
Very common, especially in Ghana here. Now, most of these are linked to postures, the kind of thing that we do throughout the day. The body is very tolerant.
How much, Sammy, can I ask you by interrupting? How much of your posture is voluntary? I want to say, do you deliberately, sit or stand or walk in a certain way?
I would say unknowingly, ignorantly. So people do a lot of things without knowing, and that is why we do some of these presentations for corporate organizing, because they are just ignorant. They didn't even know that this could cause that.
Right.
The interesting thing about the body is that it's very tolerant. So you can do a lot of things and not even know or feel that something is going wrong. The interesting thing, another interesting thing is that some time ago I used to see a lot of retirees. And they will come and they don't understand why, whilst they were active in service, they didn't have any issue, their back was fine, they never had to go to hospital. And now that they're on retirement, that's when the problems have come.
And snit pain.
And that's and that's because the body can really tolerate a lot of stuff. So you don't want to depend on your symptom, what you're feeling. You will need to have your back checked. We need to be sure that everything is fine. And also, I talked about how the muscles are what really move the bones. So the muscles are working almost all the time. We need to intentionally strengthen them.
You want to be deliberate about this?
Yes, because as we are growing, things are reducing. How strong your back muscle, for example, were some 5 years ago, it's not the same as they are now. So you need to intentionally strengthen them so they can do the job they've been doing. The bones that they are moving don't reduce in size. They are as they are. But the muscles naturally are reducing. So we need to intentionally build them up. Yes.
Very well, very well. I was called to the bar yesterday.
Congratulations.
By myself. Neck pain.
Neck pain.
How can we quickly talk about that?
So
also common?
Yes, quite common, yes.
Right, neck pain.
A lot of, social media. Madam one of the commonest, the way what we do on our phones, WhatsApping and stuff like that, the neck is, bent over. The standard is
hang on. Phone usage.
A very common cause.
Related to neck pain.
Yes.
And presentation at the physiotherapist.
Yes. We call it tech neck, because you're down there and you're TikToking, you're WhatsApping and all of that. Unfortunately, it's more like your head is dropping. The force of gravity is acting on your head. So there are muscles in there. We call it the deep neck flexors. They are working. They're overworking. And so they want to prevent your head from dropping.
The also have a head or neck drop,
Yes. Yeah, I mean, so all of these things, they say anything you do for a while becomes a habit. So most of what you're talking about until now it started gradually, certain posture, how you positioned your car seat, how you positioned your office decks, your office seat, how you're using a laptop without a stand, so your head is dropped. The standard that the upper border of your monitor should always be in line with your eye. And that includes
So there are certain behavioral and lifestyle changes that would be recommended, after a proper, in-depth assessment
Very important.
is conducted.
Very important.
Okay, great stuff. We've got about 3 minutes left. Hello, Nortey. And guest, I would like to know if it's too late for you to right this wrong. Long-lived sedentary lifestyle into retirement. If you've already been diagnosed with lumbar spondylosis, 9 or so, if you suffer stiff neck often, do you need physiotherapy?
Yes, now you do. I mean, if you have stiff neck. The body has gotten acclimatized to a certain way you've done this for a long time. And I always say that just like you did the wrong things for a very long time and the body got used to that, we can also reverse it and do the right things for a very long time. What people miss out is doing the right thing for a long time. So one, we need to know what went wrong, and then we correct it, and we advise you to continue doing the right thing for a very long time. So for example, people like to sit down, turning to one side because maybe their computer or laptop is shifted to one side.
Okay.
So you are doing things to favor one side of your body. The body has got muscles which are bilateral most often. So unknown to you, you are doing things to favor one part or one group of the muscles. They get tougher than the other side, and then they kind of pull the spine to its side, that side which they call scoliosis. But that is just one example. Anytime you do things to favor one side of your body, it can give issues.
Okay.
All right.
Right. Somebody sending something about the outbreak of something on some campus and a rector and so on. I'm not in a position to comment on this. Okay. So send it to the appropriate quarters. But he suggests an outbreak of something which I'm unwilling to, should I say, amplify on my platform. And I guess you agree with me, why I won't do that. Okay? Good afternoon. Good education on physiotherapy, please. How much per session? Is this Kwame in Dansoman at his facility? People like to know costs.
So the first visit is 450 Ghana cedis.
Right. Is that a session or is it your
so that is what I'm giving for free.
Please go ahead.
Yeah. So that's what I'm saying. So the free voucher I'm giving out is for 450 Ghana cedis.
Okay.
If you didn't have the voucher, that's how much you'd have paid.
Okay.
Yes, and that includes assessment and treatment.
Okay.
And
all right. Great stuff. Hello, Nortey. My mom has been complaining of pains in her waist and right thigh. Okay, right thighs. What could be the cause? She has been to hospital on many occasions, but no change.
So it would be good to know a bit of history. I mean, how did it start? What provokes the pain? Is it there all the time? Okay. Are there activities that aggravate these pains or not? Are there any activity that ease, this pain or not? So,
all right.
Yeah.
Last days are dangerous. The day has arrived. The day.
Finally.
Can physio help to manage arthritis? What about the inversion table equipment? Does it help at all for back pain? My aunt had one and swears by it, but still complained of back pain. They did in Maryland.
So arthritis, yes, can be managed. I mean, we don't have a cure for arthritis, but once you break arthritis down, what is happening in the joint, whichever joint we are looking at, is a breaking down of the structures there. So it could be how do you call it, the cartilage. Then we are also having the bony spurs and all of that.
Okay.
All of these structures are held in place by muscles.
Okay.
So one of the basic things we do for arthritis is really to toughen the muscles holding this particular joint together.
Okay.
Some people would go, for example, for a knee brace. The knee brace will not solve the problem. It will give you, transient relief, but then it's actually mimicking the job of the muscle.
So
and so we're supposed to toughen
and not the roots.
Exactly.
Okay.
Sure.
Okay, folks. The brace that holds me in place is the studio clock, which has gone 1 minute past 3 p.m. Right, which means we're done for Ultimate Health. It's been great. It's been productive. Sammy, you mentioned Abilimpi. Where exactly in Abilimpi? So
when you enter Abilimpi from the traffic lights, there's only one filling station at Abilimpi. It's called the Icon filling station.
All right.
So you take a left turn at that junction and you drive down. Yes. So the road naturally turns to the right, where the second gate.
E.T. Mensah used to live on that street.
I had. We're opposite the Abilimpi Methodist Church.
Okay, great stuff. Sammy Otu, unfortunately, yes, he went to
a very good school at the Southern College.
A relatively good school. Santa.
Yes, sir.
Right, but he knows where it's at. I went to some school down the road, but we've been most grateful.
You're welcome,
and humbled to have you again. You're welcome. I'm so sad we lost about 15 minutes, but we made up for it. And I hope that the listeners, I will contact them directly. They will take the opportunity. And those who didn't get a voucher, there are a couple of you receive text messages from me directly as well. All right. Some people become my text friends just because of some of these things that I do. Okay, great stuff. And yeah, Ziggy comes up. Did we give a voucher to the Ziggy?
I'm not sure.
All right, this is Nortey by Nature signing off. Many thanks to Ziggy. Holds the fort here, connects everything by spinal fluids and nerves and all that. My name is Nortey. I'm out. Stick and stay.